Hello everyone, welcome back to my channel. In today's video, I'm going to talk about how you can become a healthcare assistant or a carer in the United Kingdom. Well, one would ask me, okay, what are the requirements or who qualifies to be an HCA or a carer in the UK? Well, there is no qualification. You do not need to have a degree, or maybe a bachelor's degree, master's degree, or a diploma. All you need is to have gone to a high school, senior high school, and have your certificate. Let's say if you schooled in West Africa, in my country it's called WASI. You need to have written the WAEC exam. Yeah, that's the only certificate you need. You don't need to have any sort of higher level, higher learning certificate like a degree or a diploma. So if you want to be a healthcare assistant or a carer, it can be grouped into, I'll say, two different types, because you have the HCEs, that is the healthcare assistants, or the carers. They are the people who work in the hospital and in the care homes. They work with the nurse, they provide personal cares for the patient, such as giving them their baths, helping them with cleaning their teeth, making their beds, and like making sure they are comfortable. They also help patients with their food, such feeding them. They also help patients with their mobilization. Maybe the patient wants to go to the washroom, the patient wants to take a walk around, they can help them with that. And also they help with the observations of a patient. They monitor the vital signs of the patient and relay information back to the nurse if there is any problem. The second one is, if you want to work as a domiciliary care worker, those ones work more in the community. They go from house to house to provide care for patients. They also do some care, such as providing personal care for clients, such as helping them with their bathing, cleaning of their teeth, their toileting, and all that. They provide them with companionship. They help them with the administration of their medications, and also they help with the mobilization of patients. Maybe the patient wants to run an errand or wants to go grocery shopping or something, you can help the person out. And I mean, basically, they help with the general household activities a client cannot do on their own. Maybe if you have a client who is an elderly and frail person who needs someone to assist them, that is the job of a domiciliary care worker. Yeah, but to become a domiciliary care worker, I would advise you get a driver's license. Yeah, most of them, you need to get a driver's license because you'll be moving in the community. You'll be moving from house to house and you'll be driving. Nobody has time to be driving you from house A to house B. So I would advise that before you get here, you should try and get a driver's license back in your country, because you can use your home country's license in the UK for a year. Yeah, an international license, you can use it for a year until you finally switch to the UK driver's license. So I would advise that if you want to opt for the domiciliary care worker, you should get a driver's license to make things easier for you. So now let's go to the requirements to become a care worker at HCA or a care worker in the United Kingdom. What you need before you can become one. Well, first and foremost, you need a valid passport. You need to have a passport that you can travel with, and make sure that the expiry date is not so close to when you are applying for this whole process, because if there's left with some few months for your passport to expire, most of the time the chances of getting a visa is very, very low. So you need to have a valid passport. And also, who qualifies to be a health care assistant. As I said earlier on, you don't need any qualifications such as a degree or a diploma or a master's or anything. But one thing I can say is that if you have an experience or a background in healthcare already, it's a great opportunity. You have an upper hand over somebody who doesn't have any experience at all. So let's say you are an auxiliary nurse, you're an enrolled nurse, you have a background in nursing for 2 years, you have worked in a hospital before, in a clinic, you have the opportunity to be selected or get a job more than somebody who has no experience in healthcare. Also, it's actually a great rule for registered nurses. Probably you do not want to come as a registered nurse, or you have been trying to get the IELTS score. We all know the band score for registered nurses and midwives is 7.0, which is extremely high. Most people have written the exams several times, but they are still not getting the score. The scores for the HCAs are quite low, so you can write the exams for an HCA and apply through that route. The chance of you getting the job is much more higher because you're already a registered nurse. So it's a way to come into the UK as you're working as an HCA or a carer. As time goes on, you can write the exams again and upgrade yourself to fit into the role you're supposed to fit into, which is a registered nurse. So it's also like an opportunity, but then there is no qualification to this particular job role. Anybody can apply for it, but if you have a background in healthcare, it would be an advantage to you. This particular one is not a major requirement. It depends on who is recruiting you. Some people might ask that you should have taken some care courses, or you should provide them with a care certificate. For my own personal point of view, I would advise that anybody who is applying for this job should just do these care courses, because it gives you let's say I'm an employer and I'm employing people. I have set out the vacancies that, okay, I need somebody to fill in the position of a healthcare assistant. I would obviously choose somebody who has done a care course over somebody who has nothing. Because, okay, the qualification says no background in health or no qualification. That means you can come in just like that. I'll obviously choose somebody who has an experience, who has done a care course or a certificate. So I would advise that you go online. There are lots and lots of care courses. I think the care certificate comprises of 15 standards. Yeah, you just need to go through it. It's something simple. It talks about dementia awareness, mental health awareness, safeguarding children, infection prevention, maintaining privacy and dignity, just to mention a few. It's not something that is difficult. You can just go through it, get the care certificate and add it to your documents when you are applying for the job. Also, you need to have a well-structured CV. And with regards to the CV, at this point, you need to put in all your experiences you have had, add your care certificates. Let's say you have worked in a hospital for some number of years, whatever, a clinic, whatever you have done, you add it to it. At this point, I will also give an advice that if you do not have any background in health, you have never worked in the healthcare settings before, I would advise that you just look for some time and go and do volunteer work, do voluntary work at any hospital or any clinic, and make sure that you let them know this thing I am doing. When it gets to a point, I will need a reference from this facility, because definitely if you are building your CV, you need to put in references for whatever work you have done. So if you have done a voluntary work in, let's say, hospital A, you need to let the nurse in charge or the matron or whoever is there, you need to let the person know that, okay, I'm doing this kind of procedure. At the end of the day, I'm going to need a reference from here, so that it can be a reference for you when you are filling in your CV. Because as I said earlier on, most employers will choose somebody who has had some sort of experience in healthcare than somebody who is just coming in just like that. So I would advise that you do some voluntary work if you are chanced. Also, when you're coming to work here, you need to write an English proficiency exam, which is the IELTS General UKVI. You need to write the IELTS and get a band score. I think it's from 4 to 5. The band score is actually lower for healthcare assistants, so it's easier for more people to get in. Unlike the registered nurses and registered midwives, it's quite tough to get 7.0. I won't lie to you. It's not an easy task, especially when it's IELTS academic. It's difficult. So for this one, the band score has been lowered. It's more easier for you to pass. So you need to register for the IELTS and sit for the exam, and make sure you get a band score from, I think, 4 to 5, upwards. Any of that is good. But some employers insist they want 5, some want 4.0. So you need to look at all these. And if you're looking for a job, you need to look at all this, because not everybody accepts 4.0, but ideally 4.0 is good. Most people would take it. So you just need to get your IELTS done, register for your IELTS, get it done, and then you can start looking for jobs. And when it comes to the job hunting too, there are lots and lots of websites. You can go to some websites such as Indeed, Indeed, and then you type in carer jobs that offer tier 2 visa sponsorships for overseas carers. It will bring out a whole bunch of jobs in that category. Mind you, just don't go and type you're looking for carer jobs, because some of them, the job states they want somebody who's already in the United Kingdom. So you need to make sure you type overseas. If you type overseas, it will bring out jobs that require people to come from outside. But if you're just looking for, because people will complain, I've been applying, I'm not getting any feedback, I'm not getting any positive feedback or something, it's because probably you're not applying in the right way. Probably you're not really reading what the employer is saying. Because before an employer will put a job out there, that means they have looked for somebody in the UK and they are not getting. That is why they're looking for overseas. So you need to make sure that whatever that is there is not asking for somebody in the UK already. They're asking for somebody who is abroad. So once you start going for this job hunting, for people who are overseas, I'm sure definitely something would pop up that is going to suit what you are looking for. So after you have gone through the job search and all that, you need to get a job offer. Yes, because without a job offer, you cannot get a certificate of sponsorship, which is the COS. Without a COS, you cannot start the visa process. So you need to make sure that you have gotten a job offer, you've gotten an employer in the United Kingdom who's willing to give you the certificate of sponsorship, which is the COS. That is what you take to the embassy for your visa. And also you need to be sure that the COS is going to cater for you. They're providing maintenance for you. If the employer is not providing maintenance for you, that means you need to put in a certain amount of money in your bank account for 28 days before you can go to the visa. You can go to the embassy for your visa. But if the employer is taking care of your maintenance, taking care of your maintenance means they're going to give you accommodation to stay in when you get to the United Kingdom. They are taking care of, they are sponsoring you, so you don't need any funds to put in your bank account, and some are paying for your flights, your visa fees and everything. They're taking care of your maintenance. So with that one, you are good to go. You don't really need any financial help, like looking for money to put in your bank account. You don't need all that. But if they are not taking care of your maintenance, you need to look for funds and put in your bank account to let the embassy know that you can support yourself when you get here, because your employer is not doing that for you. That means you need to get your own accommodation, book your own flights, pay your own visa fees, and feed yourself and everything once you get here, because there is no maintenance for you. So you need to be particular about the COS. After you've gotten your COS, you can start the visa process and the visa application. Also, you need to do a tuberculosis test. Yes, tuberculosis test is very important when you're moving into the United Kingdom, because normally you're going to be working with the aged and people who are very old. And people who are very old, they are very susceptible to getting contagious diseases. We all know TB is a very contagious disease that affects the lungs and the chest. So you need to test for TB. I think there are centers in most of the countries. If you don't have a center in your country, the embassy will redirect you to go to a nearby country to go and take the test. Yeah, I know there's one in Ghana, Accra. The other people from other neighboring countries come to get tested. So yeah, wherever country you're coming from, even if you don't have one there, the embassy, they will redirect you where you can get a TB test done. Yeah, so you can get a TB test done and add it to your documents when you're going to the embassy. Also, you need a police clearance. Yeah, you need a police clearance from any country you have lived in within the past 6 months. It's the police clearance is like a criminal record. They need to find out that, okay, this individual does not have any convictions or any charges or anything. They just want to know your criminal background. So you need to go to your country's police department and ask them to get you a police clearance so that you can clear yourself, that you don't have any criminal activities attached to your name, because every employer would need to know whoever they are employing. They need to do background checks on you to be sure that, okay, this individual is somebody we can trust our clients and our patients in, the person's hands. So you need to get a police clearance. So after you have gathered all your documents, let me list the documents you need again for your visa application. You would need a valid passport. You need to have a valid passport. You need to have your police clearance, your TB test certificate, your IELTS UKVI, your COS from your employer, which is a certificate of sponsorship. You need to have that. And finally, you need to have your job offer letter. These are the documents you're going to send to the embassy. Yeah, so after you have gotten your visa, you're going to be on your way to come to the United Kingdom very soon. One thing I want to say is that getting accommodation in the UK is quite difficult. So before you get here, you need to ask your employer if the accommodation they have for you is for only you, or it can accommodate your family, because I know people who have family would want to come with their dependents. Yeah, and sometimes these employers provide accommodation for just one person. So you need to make sure that, okay, you find out whether it's just for you or it's going to take care of all your family members, because if not, that you get here and you become stranded. So you need to find out all these things about accommodation. Yeah, so that's just about it. Somebody asked me, okay, what are the benefits of coming here as a healthcare visa? The benefits are you can come in with your family, which is your dependents, your husband, your wife, your kids. You can also get your permanent residence as a in the UK after having worked for 5 years. So yeah, these are the benefits that come with working on a tier 2 working visa. So that's that about coming as a healthcare assistant or as a carer. Yeah, either of them. These are like the procedures, the process you need to go through. If you have any questions, you can leave them in my comments. I'm going to answer you. And also, if you are new here and this is your first time here, don't forget to subscribe to my channel. Thank you. See you in my other videos. Bye bye.